When dealing with a combative patient, you should not ignore the signs of the situation approaching, you should not be argumentative, you should not have a condescending attitude with the patient, and you should not lie to the patient. Threatening the patient with restraints causes the patient to want to prove themselves. You should not negotiate with the patient, and you should not try to handle the situation alone. Also, a threat to call security also invites aggression from the patient, and you should not deny or downplay or simply ignore their behavior.
Where's my nurse? I need my nurse.
Wrong?
I need pain medicine now.
Calm down.
No, I'm in a lot of
You
pain.
need to calm down, ma'am. You're disturbing other patients.
Where's my pain medicine?
If you're going to continue this way, I'm going to have to tie you up and call security, okay?
I want to go
Enough is
home. I just need
enough.
pain
Enough is enough.
medicine.
Stop it.
You're going to give me my pain medicine.
As you can see, the video had many errors. First, the nurse entered with a threatening, frustrated attitude. This aggravated the patient further. She didn't address the patient's complaints, and she threatened the patient with restraints and calling security. She also should have brought another person to assist with the situation in case of escalation. When dealing with a combative patient situation, first, you should always identify potentially aggressive situations with aggressive patients. Look for signs and symptoms of potentially aggressive patients. You should also place the patient in a gown if possible to remove potential weapons. You should assess the patient and the room for any possible weapons and remove those. You should identify your panic button, which would be like a staff assist button. You should never wear dangly earrings, necklaces, or neckties when dealing with these patients, or if you are at risk for dealing with these patients. And you should leave your stethoscope, scissors, or other materials that could be used as weapons outside the room. Limit setting is very important with these patients. You should say things like, "I can help you, but I cannot allow you to threaten me or the ED staff." You should also be an advocate for your patient by offering a soft chair, a blanket, or something to eat or drink if these things are appropriate. This helps to establish trust with your patient. You should not be confrontational with the patient. You should always be attentive and a receptive listener. Try to always stand an arm's length away from the patient in order to maintain safety. And you should always keep eye contact with the patient, but avoid prolonged aggressive eye contact because this can potentially aggravate your patient. If appropriate, try to help your patient to begin to share his or her emotions by acknowledging their emotions that you see, saying things like, "You look angry." This will help them to begin to share what they are feeling and help to de-escalate the situation. You can offer supportive statements that build up your patient, saying things like, "You obviously have a lot of willpower." If and only if our verbal techniques are unsuccessful and escalation continues, leave the room and seek assistance, which would first be another person or restraints. And if you choose restraints, you must explain why the restraints are necessary. If available and appropriate, you can create a restraint team, which would be a team of 5 people, ideally, that enter the room with a professional attitude and with a presence. This may calm a lot of individuals by protecting their ego, and later on they would say things like, "I would have fought back, but there were too many against me."
Nurse! You can't get any help around here. I need pain medicine now.
Okay.
I'm hurting.
Sure. Let me take a look at your orders, and I'll be able to give you some pain medication. This is Blakely. Doctors are actually discharging you home. She's a case manager.
I can't go home. I don't have a ride.
Oh, we did get you maybe a cab voucher so that you don't have some.
I don't have money for a cab.
Yeah, you don't have to pay for it.
Can you just give me my medicine first?
Sure,
I
ma'am.
need pain medicine.
Sure, just give me a few minutes, okay? I'll be right back with pain medication. I'm sorry that
Can't
you
get help around here.
Do you want anything else?
No, I need pain medicine now.
Okay, we'll check on that. We'll be back, okay? Let me get you a glass of water and pain medication. We'll be right back. Thank
Okay,
you.
hurry up.
Actively listen to your patient. If they say things like, "I am so mad," you can respond by saying, "What has made you this angry?" This will allow them to share their feelings with you. Respond to their statements by using reflective statements and say things like, "I understand your reason for being angry." Partner with your patient to find a possible solution to what they are feeling. You can say things like, "You are so angry because the wait time was so long. I'll be sure to be as quick as possible from now on." You should not be drawn into a shouting match or allow your emotions to escalate to the point that you are just arguing with the patient. If that starts to happen, you should step away. Give options to your patient, but do not negotiate. You can say things like, "Another option you have is this." You should explain the reasoning for your actions. If you have to use restraints, you need to explain the reason for those restraints, that it's for the patient's safety and the staff's safety as well. You can say things like, "It seems as if you have a different viewpoint of this situation. Let me explain my position." This will allow the patient to feel that you are communicating rather than you just giving demands to the patient. Some more tips for communicating with an angry or combative patient. Try to speak softly with the patient and use a non-judgmental attitude. Remain neutral. Don't argue with the patient. And like I said before, keep physical distance between yourself and the patient. Don't make intense eye contact, but do make some eye contact. Remain in control without being demanding or authoritative. Don't bully the patient into better behavior. That's just not going to work. And the most important thing to remember is that whatever the patient is doing, their actions are a symptom of the condition or disease, and it's not something to take personally. If restraints must be used, you should only use them when our verbal techniques have been unsuccessful. You can't just use a restraint for convenience or to be punishment for the patient. And we've all heard our nurses say, "If you don't stop this, I'm just going to tie you down." Well, that's not the best way to handle the situation, and it doesn't provide a reason for the restraints. However, restraints are sometimes necessary to facilitate the diagnosis and treatment of the patient, and they can be useful to prevent injury to the patient and the staff. If you must use restraints, you should always document alternative methods that you tried and the specific need for restraints. So instead of just saying the patient was combative, you need to say, "Attempted to verbally diffuse the situation with therapeutic communication and limit setting. However, restrained the patient due to patient's threat of beating up the staff and swinging at the staff." That is appropriate documentation.